Hi, my name is Chris Caldwell, and I'm the founder and executive director for the nonprofit End of Life Psychedelic Care. It was my distinct pleasure to speak with Thomas Hartle in December of 2023 about his journey with psilocybin and his journey with stage 4 colon cancer. Thomas was one of the first Canadians to be approved for psilocybin therapy through a special access program in Health Canada. Since then, he has undergone 7 psilocybin journeys, along with 86 rounds of chemo, and he attributes his psilocybin journeys to not curing him, but to giving him the energy to turn to healing and not to battling his cancer. Come along with us on this awe-inspiring journey as Thomas explains his almost 8-year journey with cancer, as well as his now 4-year journey with psilocybin. Thank you.
Thanks everybody for being here. It's always a privilege to be able to speak to so many people on a topic that has been so very, I guess, life-changing for me personally. I am not aware of everybody's circumstances here. For those of you who don't know who I am Thomas Hartle. I've had stage 4 colon cancer since 2016. I've been sort of dealing with stage 4 for some time now. Uh, Different degrees of success. I had some very good success with my treatment between 2016 and 2017, where I had 2 different surgeries and 12 rounds of chemotherapy. The surgeons thought that they had really everything sort of in control and whatnot. Unfortunately, in 2019, I started to become more symptomatic and started to experience anemia. So we went in and had a scope done and found the completely clear PET scans that I had been getting every 3 months had totally missed 2 tumors on my large intestine that they were able to detect visually with the actual colonoscopy. So we scheduled the 3rd surgery for 2019, and when my surgeon opened me up, he found that there weren't just 2 tumors on my large intestine. There were actually 40 some tumors that were distributed really comprehensively. And at that point, I really realized that the best diagnostic tools that we have available and the best intentions and whatnot of doctors were uh, really ineffective at being able to tell me the state of my condition. And as a result of that, the doctors can't really tell me how much time I have left or how things are going. It's really just a matter of guesswork for me. What I do know is that the end could come for me kind of at any time, is what my surgeons have told me. So on any particular given day, I could have a rupture in an intestine that is not operable. On any other day, I could have a blockage. So, for example, about 3 months ago, I was hospitalized with a number of different blockages in the intestines, and to be honest, I thought that was it. So, any given time, that's kind of the circumstance that I'm under. So, when I say that as a result of my diagnostics, I have end of life distress, my end of life distress has been sort of immediate and urgent. That is sort of where we begin. In late 2019, my mother-in-law passed away unexpectedly. My father-in-law came to live with us, and he also has had stage 4 cancer. And about a month later, he passed. A couple of months after that, my own father passed away, and a couple of weeks after that, I had a niece also pass away from cancer. So in early 2020, I was just sort of snowballed under this mountain of people who were very close to me, all of whom were passing away. So the knowledge that I myself had a condition that was like that really made me feel like maybe I was next in line. And I was really starting to get into the depths of the anxiety, and it was starting to really rob me of my ability to interact with my family and my friends. for anybody who's experienced really high anxiety, uh, end of life anxiety isn't really all that different from any other kind of anxiety you have. For me, it manifested as a lot of noise in my head, emotionally, and thoughts of things that I couldn't really do anything about. Some days I would be so overwhelmed that I couldn't leave a quiet, dark room, because anything above what I was currently experiencing was just more than I could handle. And other days, with the knowledge that uh, I could have a rupture or a blockage in the intestine, any gas cramps that you have, or any discomfort, of course, has to be the end happening. And so you can't possibly be away from people just in case you fall over and die, right? So a lot of my time and my life was being consumed by these sorts of thoughts and actions. I very quickly realized that this isn't really living. This is just waiting for the end. And I knew I just had to do something about that. Um, I'd had some experience with traditional therapies like cognitive things or traditional antidepressants and whatnot. For me, the traditional antidepressants really made life beige. Um, it wasn't a good trade-off to trade off not feeling the anxiety for not feeling anything. And that just wasn't acceptable for me. I had some knowledge of the Johns Hopkins studies that they had done, but when I went back and revisited that as one of my last options that I could really look into, I realized that they were having these 80% success rates for people who had the exact same sort of problems that I was having. And so I immediately started looking here in Canada for any clinical studies that I could participate in, or any clinicians who were advertising this as a service. And of course, in 2020, that did not exist. I found a patient advocacy group here in Canada called Therasil, who assisted me with the process of getting a Section 56 application, which here in Canada is an exception to the criminal code, which would allow the use of psilocybin, a controlled substance here, for the purpose of treating my end-of-life distress. Fortunately for me, I was approved for that, and in the summer of 2020, I became the first Canadian to legally have access to that as a therapy. People talk about how things like that are life-changing, and it has become a bit of a cliche, but um, I guess as a measurement, the day before I went in for my particular treatment, I did some of the standard psychometric testing, one of which was the anxiety test. I scored a uh, 30 some out of 50 on that test, which is considered quite a 36, pardon me, out of 50 on that one. So fairly high on that scale. The day after my psilocybin therapy, I scored a 6 on the same test. So for me, it was just like turning the volume down on these. Suddenly, instead of all of my thoughts being consumed by the idea of my impending doom, it was just quiet. Suddenly, you can interact with your family again. You can cook supper. You can have a chat with your kids when they come home from school and such. So suddenly, your life feels a little more normal again, and that was well, I suppose to say that I didn't realize how very consumed I was until it was no longer there. I don't know if anybody else has had any kind of an experience like that, but it's like having a migraine and suddenly it's gone. It's a very amazing and beautiful thing. I had a lot of trouble accepting how very effective that first treatment was, and I kind of messed with my own head a little bit, I must confess. Um, I did not think that it was possible for one therapy to make things that different. So about 3 months later, I had a second treatment, um, and I have to say that the second treatment for me was kind of like I'll call it a slap in the forehead. Yes, dummy, it really is that good. um, and so since that second treatment, I have found that this therapy lasts me roughly about 6 months. Um, I, I continue living, I continue outliving a lot of people that I've got access to. And of course, outliving so many people and still having a condition, still having some disease progression, anxiety does tend to creep up eventually over time, but I do find that there is a cumulative effect as well to that. After each 6 month period, I find I am not quite as wound up as I used to be. And additionally, I would have to say that it feels like as I deal with one aspect of my journey, so initially it was just all about the idea of the end of my life, and that was it. Um, and now it has sort of evolved into other things. I don't have the same fear of death I used to, but now it's thinking about ways of how can I make the future more available to my children when I'm not going to be here? What can I do to look after them? How can I grow as a person? Um, different elements I find that I never would have thought about prior to having cancer are now things that I'm exploring, and the psychedelic therapy is helping me to look at regions of myself that used to be like a hot potato for me emotionally. So not even able to say the words, uh, things like someday I won't be here for my family. Wouldn't even have been able to say the words without being extremely emotional. Nowadays, because psychedelic therapy, these very sensitive topics are more comfortable to me. I'm able to address them in a same sort of a way as if you would be comforting a friend. So they take these difficult things, sort of separate me a little bit from it emotionally, and allow me to deal with it in a much easier way. There are some things about the experience that I guess are easier to describe for some people or more difficult. Um, for me, I kind of use the story about how anxiety creeps up for me as being like you are stuck in traffic, right? For me, the anxiety manifesting as noise is like being stuck in your car in traffic. They're doing construction, the windows are down, it's hot, it's dusty, there's noise, and there might be a song playing on the radio, but you can't appreciate it because of everything else that's going on. Following the psilocybin therapy, you're still in the car and you're still in traffic, but now the windows are up and the air conditioning's on. You've got all the time in the world. It's just you and your favorite music, and you can actually enjoy the experience of just being there as opposed to not enjoying any part of the experience. You know, um, I used to have problems thinking that cancer is not fair, and what could I have done to deserve things like this, right? A lot of people go through that, and with my experience with psilocybin, I've really sort of come to the understanding that it isn't really about fair or not fair or good or bad or anything like that. Nothing to do with it. Um, I really these days just believe that we are here for the experience of having experiences. And this cancer is just another experience that I'm having. Parts of it are difficult, but at the same time, I am exploring spirituality in ways that I never would have even considered prior to having my cancer experience. To date, I've had 7 different therapeutic sessions with psilocybin, and each one of those journeys has sort of taught me new lessons and new things about who I am and what I can share with other people about the experience that might be helpful to them too. So these days, I spend a lot of my time really trying to help people understand the experience and trying to help other people get access to it. And that sort of brings me up to where we are today. My most recent experience here is a couple of months ago, so still fairly fresh. I have found that with each time I journey into the psilocybin space, it becomes a lot more comfortable for me to be there. So I don't know about anybody else, or if anybody else here has had some. Well, I know some of you here have had some experiences with psychedelics and that type of journey. For me personally, I'm finding the idea that consciousness being able to continue in states that have nothing to do with this physical body or physical reality are just really comforting to me. So in my different sessions that I have had the amazing opportunity to experience both um, single sessions. So I've had 3 different individual sessions, and I've also worked with a couple of different group sessions. One with an organization called the Wake Network, and the remaining ones through the Roots to Thrive group. Through both the Wake group and Roots to Thrive, these are group therapy sessions where there are a number of different individuals. And there is actually a really strong difference between the format that the 2 organizations have. So what I will say first off is the model that Roots to Thrive is using. I would consider that to be probably the more successful of the 2 models that I've experienced. And the elements that make it successful, in my opinion, are as follows. In the Roots to Thrive group, everyone involved has common elements. So everybody in my particular groups are all stage 4 cancer people. So we have these common life experiences that we are all bringing to it. Now, what also makes that really successful is there were 4 weeks of group sessions prior to the psilocybin experience itself. And the focus of the 4 weeks is bonding in the group largely. Now, the bonding that takes place is through a number of exercises like somatic awareness. So we, as a group, discuss how we're feeling, how our experiences have been from one week to the next. Where are you experiencing those emotions within your body? Where are you holding onto those things? It's really interesting how our common experiences and being able to discuss and share those things connects us as individuals. Now, these connections that we're making, it really feels like a very rapid family bonding. And the difference that it makes in a psilocybin session is really significant. So with the Wake Network group, for example, by contrast, the group was a similar size, but individuals with a very diverse background. So some experiencing just generalized anxiety, some suffering from depression, some suffering from traumatic loss. The differences in backgrounds is not necessarily a deal breaker, but not having the same lead up time to the actual psilocybin experience and not having those bonds with the other members of the group creates a difference in the psilocybin experience between where somebody is having difficulty and you want to be supportive to that person versus somebody having difficulty and the noise and action being a distraction from your own psilocybin experience. So in one instance, you feel very connected to the person and you want to lend your energy and your support to them. And in the other one, it is just a distraction like the traffic. So in my opinion, it is really very important to have these bonding exercises with members of a group to develop these strong connections between people prior to what can only be described as a very intense experience when you are taking high dose psilocybin like that. The bonding model, very good. Additionally, another 4 weeks of integration therapy following that really helps to solidify the lessons learned and reinforce these shared experiences between people in the group. To this day, I'm still in communication on a weekly basis with the other members of the people in all of the Roots to Thrive psilocybin sessions, whereas I would have difficulty telling you the names of the people that I was involved with in the Wake Network session. So very, very different experiences, but having the common connections and having the group integration, very important to the success of the experience, in my opinion. Chemo takes an awful lot out of me, and I have these cycles of healing and being in really rough shape with chemo. So for me personally, the farther away I am from chemo, the better shape that I'm in. But it is interesting that there is not just a psychological element to my therapy. I have found when I am on chemo, I typically have to take fairly high doses of anti-inflammatory steroids. That would be, in my case, dexamethasone. And I have discovered that there is a strong connection between my emotional well-being and my actual physical responses to not just the cancer, but the chemotherapy itself. So typically I have to take dexamethasone constantly when I'm completing a round of chemotherapy. If I am fairly close to one of my psilocybin sessions, I find that I am emotionally in a good enough place that the inflammatory response is not as severe with the chemotherapy. And in some cases, I have not even had to take the steroid anti-inflammatories because mentally I am in such a decent place that I don't even have the same inflammation response. So an interesting factor that you clinicians might want to put into there is the emotional connection between your physical well-being is something really measurable, and I'd like to see more studies taking place with that. It would be great if other people could experience that sort of a response that I have had, but I think it would be also interesting to explore whether something like a more regular microdosing regime added to the protocol might be able to maintain that emotional stability and well-being even into regular chemotherapeutic treatments. Every element that being able to deal with chemotherapy for me is just a bad day. But being able to be more, I guess, clear-headed and centered, every part of the treatment is just easier and better. Not dealing with the anxiety, not dealing with the inflammation, having lower levels of discomfort and pain, generally makes me feel like I am being more successful in addressing the cancer itself. I can't say that psilocybin therapy will cure cancer, but what I can say is that if I am in a place where I am not in this constant state of fight or flight, um, your body only has so many resources available. So you got a choice. Either you're the zebra running away from the lion and you're in that constant flight mode, um, or you can take those same resources and not be in a state of anxiety and perhaps apply that energy to being able to heal and recover from the chemotherapy. And in my particular instance, that really seems to be helpful. So, lower inflammatory response, faster recovery from the chemo, and lower general pain levels. It feels like I can use that same energy to help get as better as I can. So for me, a big part of my journey has been sort of the idea of what consciousness is and what my existence is and things like that. I have kind of evolved over the recent years as to what I sort of think the nature of the universe is and things like that. And I have some leanings towards panpsychism, which would be fundamentally consciousness is a building block of the universe. And I don't quite subscribe to what is traditional in that respect. So I don't believe that my personal consciousness is made up of these individual elements of consciousness that would make up hydrogen or things like that. But I do believe that consciousness forms the basis of the physical reality that we experience. And to that end, I would say that the physical reality of our universe would be like a bucket of iron filings. So you've got a pail full of iron filings. It's physical material, doesn't really have any form or function, but it exists. And there's probably an experience of being that bucket, but I couldn't tell you what that is. If you were to take those iron filings and you melt them down, you could form them into a tuning fork. And to me, that is giving something form and function in the same way that my physical body is the elements of the universe given a physical form and function. But again, that is just potential. Um, you can take all of the elements that create me, and theoretically, you could make another body that just looks like me, but it isn't me and it isn't conscious, probably not even alive. Now, in the same way, you have a tuning fork, and it's just a thing until you actually strike that tuning fork and it produces a tone. Now, that tone has become an energy that has been released into the universe. This energy now exists, whether or not the tuning fork exists or not. And that energy, that tone produced by the tuning fork, is what I believe my consciousness is. So my consciousness now exists in the universe with or without this body. And my experience with psilocybin, having my consciousness exist in ways that have nothing to do with this body, to me, is sort of an indicator of perhaps that might be the way things are. I don't need this physical body to exist as a conscious experience. And so someday, when this body dies, the consciousness still exists in the universe, and the energy that I am continues with or without this physical reality. I believe that I experienced consciousness from the perspective of my cancer. And the reason I say that is because the cancer is almost me. So genetically, I believe that genetically, my consciousness is sort of keyed to my DNA. And every cell in my body, I sort of think about as a community. Um, I see myself as a plural. So I am a collection of cells that have chosen to work together to be a me. And during my psilocybin experience on that particular occasion, I felt like almost me, but isolated and alone. I felt the strong desire to belong, but I felt alone and separated, apart from the group. And it gave me the realization, well, a few things, to be honest. I had a little bit of an interaction with that consciousness. And one of the things that really came out of that conversation was the thought that the cancer saying to me, do you think I really want to be here? And I realized from that it's not an adversarial relationship that I'm having with the cancer. People talk about fighting cancer, battling cancer. How can you possibly fight yourself? Right? You can't win that. The cancer is just a part of me. And since that time, instead of spending my energy fighting against the cancer, battling, trying to rid my body of this invader, I'm really trying to be more embracing of it, accepting of it, in the idea that it's a part of my journey, it's a part of me, but fighting against yourself is a battle that you just cannot win. And in doing so, I'm expending energy that I could be putting towards trying to be healing instead of being destructive to myself. And that was a very useful conversation that I had with the cancer, and knowing the perspective that it feels like it wants to be a part of me. That was completely different from what I have ever experienced in my thoughts about what cancer is. I've seen cancer destroy so many people, but at the same time, you also have to recognize that cancer is teaching me lessons that I could not have learned any other way. It's giving me experiences with patience, with being able to grow stronger in ways that I never knew I needed to.
Hello again. We're going to now turn to David Anderson, a physician, psychiatrist, and Jungian analyst, who his commentary and his question are both very relevant and will help us wrap up this wonderful and poignant video. Thank you, David, and thank you again, Thomas.
Perhaps it's a contact high, but I'm a little speechless, both in my state of gratitude, appreciation, and I also feel so happy for you that you were out of that depth of despair, were able to find this path. And how you are sharing is just a remarkable testimony towards, from my perspective, towards your willingness to surrender to something, and put words to something that in many ways is unspeakable, but also something essential. So thank you. I'm a physician and psychiatrist and Jungian analyst by experience, and also a homeopath. So I come to the psychedelic experience from a, if you will, a vibrational or energetic standpoint, both from an archetypal standpoint, but also informed by many remarkable cures I've witnessed and participated in using homeopathy, which is essentially vibrational.
Mm-hmm.
So that's my background, if you will. And I'm of course struck by your tuning fork analogy, and I'm wondering, I don't really want to be abstract because, and that's one of the challenges, and you do such an amazing job of avoiding the abstract and speaking from the experiential. That's what I mean about the contact high. To listen to you, I find myself being touched vibrationally, not just emotionally, but almost as if the energy of your experiences is moving through you. So feeling my tuning fork, if you will, sort of vibing. Maybe this is the way jazz musicians experience things, at any rate. So my question, sorry, that was a long introduction, but I thought I'd create some context. I'm wondering if over these years and experiences, whether there's a sense that you are becoming more your authentic tuning fork that is you. And I don't mean the you that you ever knew or the you that you tried to be, but the you that you are.
You know, it's funny that you mentioned that, because I feel like as a spiritual being, I am evolving over time, and I am absolutely not the same person that I was. But what I like to tell people is that my sincere belief is that if I want to be someone who does not have cancer, I cannot be the person who got it. I believe that there is an emotional component to cancer itself that is a potential manifestation. And the person that I used to be was somebody who was incomplete in many ways, spiritually, emotionally, patience, the way that I responded to people and events in my life. And both the cancer and the psilocybin elements of my journey have been very educational to me in teaching me that it's very easy to be a negative person in a negative world. But if you instead are somebody who can see the lessons that the negative world is trying to teach you, then you can be a very positive person in the exact same circumstances. The world that we live in is a place full of abundance, right? There is an abundance of good, there's an abundance of bad. And I find that I find exactly what I'm expecting to find. So I get up in the morning, and if I am expecting good things to happen, I will see all of the good things that happen. Doesn't mean that bad things don't happen. They do. But if the ones that I'm, it's like you're driving down the road and you are expecting to see blue cars. You will tend to notice the blue cars more often. And the good and bad experiences that life has to offer are exactly like that. So when I speak about in terms of evolving, I am a much better version of me because I am looking for the good things in this world, and I tend to find those good things. And that's one of the main reasons why I tell people that I am the luckiest person that I know. I expect good things to happen. Good things happen. I have been extraordinarily fortunate in having the people who I need in my life when I need them. So, for example, my very first surgery back in 2016, just as an example, at the time I had been diagnosed with Crohn's disease. And I was put on immune suppressives for 6 months. Oddly enough, the immune suppressives weren't helping at all. I was gradually getting an intestinal blockage at that time. And after 6 months, I had a full intestinal blockage that required emergency surgery. I was slated for surgery with the head gastro surgeon here in Saskatoon. I was pretty happy with that. But as I was in the room in my hospital gown waiting to go in for the surgery, they switched surgeons. Not that happy that I'm scheduled for the head guy. Some other guy. The other guy happened to be a really talented oncological surgeon. So what was scheduled for like a 2-hour quick bowel resection turned into this 6-hour surgery where they found cancer basically in 12 out of 14 lymph nodes, large intestine, small intestine, my peritoneal tissue, basically a lot of different areas. But because I had the right guy, the right time, I received the best care that I could have possibly gotten at that moment. My whole life has been full of these statistical improbabilities. Exactly like that. And once you realize that, life it can be like that for everybody. That's really sort of what has steered my attitude towards this positivity. And my experiences with psilocybin stripping away the ego and stripping away the difference between me and not me, good, bad, all of these things, that has been one of the things that has really fueled what I would consider my spiritual journey and my evolution to a better version of myself. Does that kind of answer your question, David?
Yes.
Hi again. I hope you found this journey that Thomas took us on to be, as I said up front, both awe-producing and inspirational. And I thank you again for listening. If you'd like to learn more about our end-of-life psychedelic care educational and other programs, please do visit us at EOLPC.org. Take care and have a great rest of your day.